Here's why drafting Alvin Kamara is riskier than you may think. He tore the shock-absorbing tissue in his knee called the meniscus in 2016, and his surgery involved removal rather than repair of that tear. Now, by taking out some of the shock absorber, you can imagine that the rest of the knee will then see more stress, and that's why NFL studies tell us that players who enter the league with this knee injury history ended up having shorter careers by 1.5 years, and they played fewer games than players drafted at similar positions. Kamara had an additional knee surgery in 2012, and it could have been done for another meniscus issue, but the details weren't publicly released. Still, we already know enough to say that he's at higher risk of developing an injury to the knee cartilage that lines and protects the bones, and NFL data strongly indicates that this would lead to decreased productivity if he were to sustain such an injury. For reference, this is similar to the Todd Gurley situation. Now, this is probably not developing just yet, so our concern for 2020 is relatively low, but we'd have major reservations about spending a high pick on Kamara in a dynasty league.